Hi guys, my name's Kieran and today I'm going to be discussing with you the effectiveness of behavioral therapy specifically for anxiety. So as a bit of a background, behavioral therapy stems from behaviorism, which is a theory that was created by John Watson in the late 1800s, early 1900s. He created it kind of in opposition to Freud's psychoanalytic theory, which talks about the unconscious processes and everything like that. And he opposed it because he thought that the study of psychology should be empirical and scientific. And of course, you can only scientifically measure overt, observable behaviors, and you can't actually see and observe mental processes, the unconsciousness, thoughts, feelings like that. So behaviorism was created in opposition to Freud's psychoanalytic theory. And so then from behaviorism, there comes behavioral therapy. There's four kind of themes to behavioral therapy. The first one is empiricism. Of course, this is just being able to scientifically study observable overt behaviors. And then you've got action-oriented. So in behavioral therapy, we want clients to actively participate in therapy and, go out and be actually doing stuff rather than just talking things through. We've also got present focused. Behavioral therapy typically tends to focus on present situations, present behaviors, and if past behaviors are still bothering the client, then they're considered present behaviors. And lastly, we have the theme of learning. So you've got the learning principles of classical conditioning and operant conditioning. And these are how you learn behaviors. So if you want to get rid of a bad or undesirable behavior, you can use those theories of learning to kind of undo the behavior. So next, we're gonna talk about the kind of different types of behavioral therapy. The first is behavior modification, and that's just where we want to change the consequences of the behavior. Then you have exposure therapy, which exposes the client to this fear situation that provokes anxiety or fear. You also have modeling therapies, and that's just what what the name suggests. The client learns and kind of models off of someone else's behavior to change their own. And then lastly, you have cognitive behavioral therapy. This is the most commonly used therapy out of behavioral therapy. And there's been a lot of studies on it, so this is kind of what I'm going to talk about more than anything else is cognitive behavioral therapy, but I will talk a little bit about exposure therapy. So now we're going to turn to the actual studies that have shown the effectiveness of behavioral therapy. Cognitive behavioral therapy, also known as CBT, is one of the most commonly used psychotherapies today because it has been shown to be so effective in both children and adults. So it can be used kind of all around, as well as for a wide range of disorders. So it's not just effective for anxiety specifically, it's effective for many other disorders. That's why it's so commonly used today and it's so popular of a method. So we're going to start with CBT effectiveness for children with anxiety. There hasn't been a whole lot of studies been done on children. We have more studies on adults than we do children. One study was conducted on site in elementary schools instead of in a lab. So they took a CBT therapy procedure and they kind of modeled it a little bit and changed it a little bit to make it more suitable for these children. And they had two groups, and those who received the treatment showed a huge reduction in anxiety and diagnostic criteria for anxiety disorders than those who did not receive treatment. So it was actually 95% of children who received CBT showed positive responses and did not have an anxiety disorder. compared to only 16.7% of the children who did not receive treatment. So you've got 95% and you've got 16.7%. So that's a huge leap there. And this is an important study because if you can effectively reduce anxiety in children and the prevalence of anxiety disorders in children, then you may be able to shield them from anxiety problems or disorders in the future as an adolescent, a teenager, as an adult. So now we're going to talk about the effectiveness for adults with anxiety. And like I mentioned, there's much more research done on using adult participants than there has been children. So there's just been a lot of studies that show that CBT is generally much more statistically significant in showing positive outcomes than people who did not receive treatment or received other types of psychotherapy or just were given placebos. So all around, it's been shown to be much more effective than other therapies. And there's also been a couple of studies done on its long-term effectiveness, and it showed that it can be effective for up to 10 years and as well as have low relapse rates. So CBT can not only provide relief and positive outcomes for many years, but it's also kind of protects people who have gone through this treatment from relapsing and having that anxiety disorder again later in life. So that's really cool because, you know, you want to get rid of your disorder, you know, you don't want it to come back. So not only is it effective for a long time, but those who go through CBT are less likely to relapse. Next, we're going to talk about exposure therapy. So like I mentioned, exposure therapy is where you expose clients to their fear or anxiety-provoking situations. You have a type of exposure therapy where they simply think about the fear or the situation in their mind. And you also have in vivo desensitization, which is kind of a subgroup of exposure therapy where you actually they see their fear in real life. So maybe if someone has an immense fear of dogs, kind of an irrational fear of dogs, I would say, you can either have them think about situations in their mind in which they encounter dogs or are petting a dog, or you can actually bring them a dog in real life, have them interact with it. And exposure therapy just works to show clients that there are no real kind of negative consequences of this fear. Like, you know, if you have a fear of dogs, maybe that fear stemmed from being bitten by a dog once in your childhood. Not all dogs are aggressive or mean, so exposure therapy just works to reduce anxiety about a certain situation or fear by exposing them to it and showing them that there's no real harm being done. Exposure therapy is effective for both children and adults. In one study, children received 6 to 8 sessions of exposure therapy, and it significantly reduced anxiety about social anxiety, separation anxiety, and just a general anxiety. And it was more effective in reducing symptoms of pediatric OCD than medication or other psychotherapies. So it can relieve a lot of childhood disorders like fear of the dark, fear of being abandoned, you know, by a parent, things like that. And there's also, again, there's a lot of literature that demonstrates exposure therapy's effectiveness for adults. One is in particular is social anxiety. So with social anxiety, it's kind of a subgroup of anxiety disorder that you fear large groups, and through exposure therapy, the therapist may have them think about maybe walking through a grocery store, you know, and just thinking about it usually elicits fear in the client. And you can, in this way, you can kind of talk them through coping mechanisms and everything like that. Or the therapist can actually take them to a crowded space, like a grocery store or a mall. And through that, they can also walk them through coping mechanisms to show them that there's no real negative consequences to be associated with it. Now, even though it has been shown to be very effective, there are some problems with it. A big one is that usually behavioral therapists pay no attention to emotions. Again, emotions, thoughts, unconscious processes, those are things that cannot be observed overtly, so it's not really a cause for concern. So, but focusing simply, I feel like a lot of thoughts and emotions are tied to anxiety disorders, so not addressing the underlying emotions tied to it may be a problem, and you might not be able to get to the root of the problem and be able to fix it all the way, I guess you would say. Also, behavioral therapy tends to address specific situations rather than patterns of behavior. And this is a problem because if you pay attention only, if you focus only on a specific situation that happens at a specific time in a specific setting, then it can't really be generalized to other patterns of behavior. So therapists should take the time to kind of think about the client's life as a whole and their micro and macro systems. Also, a lot of clients, of course, they're gonna have individual differences. The same, following a strict therapeutic treatment plan is not going to work the same for everyone. So following a strict CBT program is not going to work for every single client with anxiety because they do have their unique characteristics and individual differences. And that's a big problem because researchers have shown that this specific type of behavioral therapy, CBT, is effective for many disorders. So I think therapists tend to adhere to that strictly, but they should also be really getting to know their clients and thinking about their individual differences and incorporating that into their treatment plan so that they can be able to tailor treatment to the specific needs of the client. And that can, of course, provide better research and therapy outcomes. So that's another big problem, is that they don't focus too much on individual differences. Next, we're going to talk about ethical issues. So the big one is exposure therapy. In exposure therapy, you're deliberately kind of evoking fear and distress in the individual by exposing them to their fear. And this kind of goes with the ethical code of do no harm and minimize harm. But it's shown that a lot of clients actually have preferred exposure therapy because it's been very useful for them, and they don't really mind it. It's not a big problem for them because it has shown to be so effective for clients. One of the big concerns with exposure therapy is that some people fear it will worsen symptoms rather than decrease them. But this is shown in many different research studies that only a minority of people who go through exposure therapy, their symptoms get worse, but a majority of them, they get much better and their fears are significantly reduced. But it's important to note that at the onset of exposure therapy, there is going to be that little bit of a time, they call it an extinction burst, that little bit of time where the client's going to be very fearful until they get over kind of that hill And then, of course, with practice, they're going to get better at reducing their fear. So there is going to be, you know, at the start, there's going to be a lot of anxiety and fear, but it will get better with practice. And lastly, some future research for behavioral therapy. The big one is kind of looking for ways on how to individualize behavioral therapy and CBT specifically so that we can tailor our treatment methods to the individual needs of the client so that we have a better outcome. And also, a lot of CBT studies have been done in the lab rather than in real world settings. So we want to try to bridge the gap between practice and research. So one way to do this is to have researchers and clinicians, you know, clinicians are the one actually doing the practice, researchers are the one researching in the lab. So we want to get them together to collaborate on the research process so that clinicians who actually, you know, experience these real world problems with their clients can give input to researchers who may never even practiced it at all. So getting the two to collaborate together will really help to bridge the gap between practice and research so that we can make CBT and behavioral therapy outcomes more effective. I think that's about all I have for this presentation. I think behaviorism is one of my favorite theories, so being able to look at the therapy practice that has stemmed from it has been really cool, and I hope you all enjoyed this presentation, and thanks for watching.